what do Dr. Mark Hyman, Dr. Josh Axe, Dr. Alan Christianson, Kiiko Matsumoto have in common? They are holistic health practitioners who are very well known in their fields, and they have one thing in common, which is they all speak. So they started out speaking and they also continue to speak and educate. Why is that? Because speaking is one of the most fastest ways and effective ways to be growing a practice by educating people about how you could help. One of the reasons why people may not be coming to you yet is because they either don't know about you or how you can help them. But if you're able to educate them more about that, and they also get to experience whether they resonate with you or not, they're much more likely to come in. And so good to see you here. And I'm Chen Yen, your 6 and 7 figure practice makeover mentor at introvertedvisionary.com. And we help holistic health practitioners grow fulfilling practices that they're proud of and accelerate the growth to multiple 6 and 7 figures the introverted way. I will say that I've talked to thousands of practitioners at this point: acupuncturists, chiropractors, naturopathic doctors, functional medicine practitioners, and health coaches, all the different approaches that they've shared with me about what's working and what's not to grow their practices. Hands down, speaking still one of the fastest ways to be getting a practice up quickly. But I know what you might be thinking. You might be thinking, well, but I get nervous, or I'm not sure what to say. And, my heart beats kind of fast. And then I might feel like a little bit of a fraud. And, you're not alone with that. I grew up in a family that's very strict. We're first generation immigrants from Taiwan. My dad's a PhD engineer, research scientist. I remember when I was around 8 years old, and when Sunday came around, I would just feel really jealous of other kids in the neighborhood because I felt like they were so lucky. They got to read comic strips, and whereas my dad would have me do a current event talk every Sunday, and I dreaded it. He would critique me to the point where I cried every week because he had a very different style of speaking and very left brain as well, very different from how I tend to speak. And so it was such a traumatizing experience for me that I remember saying to myself, I will never speak. I will never speak in front of an audience if I could help it. And so but what led me to end up speaking is because I love teaching. When I was little, the funnest thing for me was getting these kids in the neighborhood to be sitting around me, and then I would teach them things. I used to go to my third grade teacher in school and get these worksheets and then give it to the other kids I was playing with. And that was like, it just gave me so much joy. So I always loved teaching. And I came from a family of teachers. My mom's a teacher, my grandma's a teacher. My grandpa on my dad's side is a teacher. My grandpa on my mom's side, it was a principal of a school. And then my grandma was a teacher. And then my uncle is also a teacher. So it came from a family of teachers. And so, I absolutely love teaching. That's what led me to want to educate and speak and help more people because the healthcare system the way it is, especially from my experience of having practiced in different settings, in the hospital setting, in the outpatient setting. I've also seen the insides of the FDA and at Merck. It's not going to be the drug companies that change things. It's not going to be the insurance companies that change things. It's not going to be the government that changes things. It really starts with you being able to get the word out about what you do so that people are asking for it. And that's when things will change. And imagine where things are the best of both worlds, where people have access to the wonderful things about our conventional medical system, especially for acute situations. And then also have the other integrative options that they actually understand and have access to and know about and can get help with. Because these are things, our healthcare system is so upside down of where it is primarily about sick care. And people just rely on going to the doctor and then getting drugs and medications because there aren't really as good options presented in front of them aside from drugs and surgery. Yet there are other options that could be really supportive of health issues that a lot of people are encountering. But they don't know about how you exist. They don't even know that there are options outside of what they're being told by their doctors. And so if we aren't educating them about these options, then who will? If we keep our mouths shut, then who will actually be in better understanding of this? So both from the perspective of educating the lay public audience too, so more people understand and they uh, recognize that there are other options. And then also educating providers. So whether they're conventional medical providers or other kinds of even holistic health practitioners to help educate them even more about the scope of what you could really help their patients with. And when they understand more too, then they will be able to educate their patients about it. And that's when there will be more of a ripple effect of where imagine where holistic options are actually first line of care in this country. Imagine what that would be like, where people would have access, where people would have help, where people would be able to have help in a more integrative way as a first line of care. And then only if it doesn't make sense because it's an acute situation or it's already gone way overboard with the possibility of being able to be helped through holistic options, then conventional route makes a lot of sense. And so it's up to you to really educate and be a part of the change of our healthcare system. And if not you, who? And if not now, when? And so one thing I'm excited about that's coming up is I'm hosting a free masterclass that is all about being able to put you on the map more as a go-to practitioner and become more in demand while you're educating more people about how you could help them. And in a way that is leveraged, meaning that because as introverts, isn't it exhausting to feel like you need to be always networking or putting yourself out there or having to be doing all sorts of things that feels like posting on social media where it feels really exhausting to feel like you have to do this all the time or spend money on ads. And then even if ads are working, there's it's still money going out the door every single month. What if you could keep that in your pocket more? What if you could actually be filling up your practice more and also be recognized, known and recognized as a go-to practitioner? Because it's so much nicer that way, where when you are known more and recognized more in your community, then people will come to you. It's such a different feeling than like just ads and that kind of a thing. And so I'm really excited about this masterclass is coming up, and go ahead and register for it using the link and that you see here. So click on the link and register for it. And I can't wait to help you. I'm going to be getting into what kinds of opportunities there are to be putting yourself on the map more and educating by speaking. And, some of our clients are getting paid opportunities too, which is really nice. And then there are also like, how do you actually get invited to opportunities? And then how could you use this as an avenue to grow the practice, bring in more patients, and even bring in another stream of income too, for those of you who are ready for that as well. So it's super exciting. And so register now for it. And I can't wait to see you there. And then for those of you who already know that you would love help with putting yourselves on the map more, getting a repeatable process in place that can help support also you showing up, doing a talk, and getting anywhere between 5 to 10 patients just from one talk, then feel free to reach out. These are actual numbers that our clients have experienced with this. So one talk, 5 new patients. One talk, 10 new patients. One talk, 26 new patients. So from 1 hour of your time, imagine getting 10 patients from 1 hour of your time. Imagine getting 26 new patients with just 1 hour of your time, right? And so even if you got 5 new patients from 1 hour of your time, what would that do for your practice? And so the momentum builds more, people become more educated also, and you're reaching more people and helping more people through how you could help them. And it's just it can feel so fulfilling. So if you would love help with that and getting a repeatable process in place, that will also help you become more in demand along the way too, and really do what you're meant to do even more in an expansive way, then book a free call with us, and more than happy to see how we can help you with accelerating growth in your practice faster to one that you're proud of and is in the fullest expression of your gifts and strengths and how you can help people. So look forward to talking to you soon, and go to introvertedvisionary.com and book a free call, and look forward to talking to you soon.